I'm Hank Kearney, and I'm oftentimes asked for my views on healthcare developments around the world, particularly in the emerging markets. But we also look at the developed West, for instance, Western Europe, as well as markets in flux like the United States. We work with some of the largest investors in healthcare in emerging markets, but we also work with some of the small and medium-sized funds and international banks. As the publisher of the PHM Emerging Markets Healthcare Monitor, we focus on the items that we don't quantify, the political, policy, and geopolitical influences on healthcare around the world. The Arab Spring, or the Arab Awakening, has been just such a fascinating thing to observe and to follow. We've seen a lot of changes throughout the entire MENA region. As everyone is well aware, Egypt, Tunisia, Bahrain, now Libya, are all experiencing some challenges. And the Kingdom of Saudi Arabia, we see taking a rather proactive effort to impact the social issues within the country. And one of the things that they're doing is dramatically increasing their healthcare spend. And we see this as being rather problematic at one area and advantageous in another. In particular, the kingdom is embarking on a significant expansion of their hospital counts, their bed counts, an expansion of their primary care clinics, and an increased number of doctors, nurses, and medical technicians. And this is all needed. However, the bed count there, Saudi Arabia at 2.15 per thousand is pretty good for emerging markets in their total hospital and bed count numbers. So we actually see competition picking up and being rather detrimental for service providers in the kingdom, private service providers. The flip side of that, however, is that we're very positive on private health insurance. We think the competitive market that will evolve from this big expansion will prove to be very beneficial to private insurance companies and really help them out over the next 5 to 10 plus years. This third quarter was particularly interesting in terms of currency fluctuations, and in particular the Swiss franc. The reason why we're watching this is that in Poland and in Hungary, up through about 2008, many of the mortgages, both commercial and residential, were tied to the Swiss franc as a means of easy lending. So today, with the Swiss franc strengthening against the Polish and Hungarian currencies, we see this as problematic for private healthcare in the short term, the next 12 to 24 plus months. The impact of this is that as these mortgages are tied to the franc, they're going to the Swiss franc, they're going to impede some disposable income at the personal level. As the mortgages become more expensive, the residential mortgages are increasing cost to service. We do see a negative impact on healthcare at the consumer level. Now, at the corporate level, we also see a potential for a decrease in employee benefit spending, in particular for healthcare, much for the same reasons, because a lot of the commercial mortgages, particularly in Hungary, are tied to the Swiss franc. And as that franc continues to strengthen, we do see a negative impact on healthcare in the short term. This third quarter, we see that Russia continues to be a challenging market. For instance, Campbell's Soups has pulled out of the country after a 4-year effort to gain market share. However, for healthcare and pharmaceuticals in particular, we see a continued strong investment in the market. And there are a couple of reasons for this. One, the central government is continuing to put pressure on the pharmaceutical companies to increase their investments and even calling for some technology transfer. But the other reason we think is more dynamic is the demographic data that Russia has. It has a very robust middle class and a per capita income well ahead of the other BRICS. We're very positive on investments in healthcare in Russia for a variety of reasons, and it's a troubling market, it's a challenging market, but we think long-term investors will find it a great market.